The Delta variant continuing to cause a surge in U.S. coronavirus cases. Community transmission is high in most of the country, which is shown in red on this map. Everything's really bad east of Oklahoma, including that state. According to the CDC, the 7-day average of daily new cases is 130,000. That is 1,000% higher than the lowest average back in June. Dr. Christopher Belcher, a medical director of infection prevention at Ascension St. Vincent, Indianapolis, joining me now to discuss the very latest on this pandemic. First off, good morning to you, doctor.
Good morning.
All right, a lot of people want to know this one. Do you think, will this illness get better or worse come fall, in your opinion, and does it depend on vaccination rates?
Yeah, some of that's tricky to know, but I don't think we're at the peak yet. I think this is going to continue to get worse during the fall for a while. And certainly vaccination rates, as well as mask mandates and how people behave, as well as the virus, are all going to be important in determining when it peaks.
And at one time, people talked about it, kids really did not catch COVID. Now they're not only getting it, but being hospitalized for it. What's the current situation? Plus, if you're below 12, you can't even get the vaccination yet.
Right. Yeah, we don't have an approval under 12 yet. But really, my experience in the last several weeks has been I've seen more children in the hospital with COVID than I had in the last 18 months of the pandemic. So it is a bad situation for children, and things have changed. Something has changed about it, whether it's the Delta variant or something else.
So I've heard different things, and it has definitely changed over time with the CDC and the recommendations. When should you get tested? The recommendations just keep seeming to change.
They do. And what's been constant the whole time is if you have symptoms of COVID, which we've gone over before, cold-like symptoms, cough, loss of sense of smell or taste, those things, quarantine and get tested. That's been constant. If you've been vaccinated, you want a mask when you're indoors and get tested about 3 to 5 days. If you're exposed to somebody with COVID, 3 to 5 days later, get tested. If you're unvaccinated and exposed to someone with COVID, you get quarantined, so stay at home, and about 5 to 7 days after the exposure, you get tested. So it has changed with time, always available on the CDC website if you need help.
All right, by now, if people wanted to get vaccinated, you would think most have. About 100 million eligible Americans have not. There is, though, an increase in vaccinations. Why do you think that is?
Oh, lots of reasons. So some people are afraid and have seen this increase in virus, and it's made it real to them that this was not going away quickly. Some people wanted to wait. Some people said these vaccines are too new, and they have been given to, well over half the country's completed now. So that gives people some comfort. We've found all the rare side effects. We know how safe and effective the vaccines are. Lots of reasons why these go on.
Now, I've also heard, and we've got a little extra time, that 8 months since your second dose is when you could possibly get the booster shot, or should. Is there like some sort of technical reason for that 8-month timeline?
It's kind of just a draw off of, the immunity seems to wane over time. And they just kind of drew the number as 8 months being the most effective time. But clearly there is some loss of antibody and immunity at 6 months and more at 9 months, and that's just where they're proposing to put it. So I think we're going to see a lot more information from the FDA, CDC over the next few weeks that explain that and talk a little bit more about how they're going to implement it.
Yeah, sounds good. A lot of people want to know. Dr. Christopher Belcher here this morning for us. Thank you very much. We do appreciate it.
You're welcome. Thanks.
Not a problem. Daniel, over to you.